Good morning from the Oklahoma Insurance Department. My name is Wyatt Stanford, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we start, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you cannot reach an agreement regarding a claim. If you'd like to reach out to us for help or if you have any questions, you can call us toll-free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see us and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat, and if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now, I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Oklahoma Medicare Assistance Program at OID. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Good morning. Thanks, Wyatt. I am very excited to be with you guys today because today is a very important week. And more about that here in a minute. First, I want to remind everybody that the Medicare Assistance Program is a division of the Oklahoma Insurance Department. We are funded by grants from the Administration for Community Living, which provides us with funding to go out and educate the public about Medicare, what Medicare is and how it works, and how people can make the most of their Medicare coverage, as well as how to protect themselves from becoming a victim of fraud in the Medicare system. Today's topic is Medicare fraud, and that is very timely because today is the first day of Medicare Fraud Prevention Week. This is a very important week for everybody because Medicare fraud is a huge problem. We're going to talk about that today and important things that people need to remember. Every year, Medicare Fraud Prevention Week occurs in the week that contains June 5th. I know that seems a little bit confusing, but if you think about it, what they did is they took June 5th because it's 6-5 or 65, which is the age when most people become eligible for Medicare. So this year, that is the week of June 2nd through June 8th. So we're really focusing this week on educating people about Medicare fraud, the concerns about it, how to protect yourself, and really reaching out, trying to make sure that everybody understands how they need to be very vigilant about protecting themselves, protecting their Medicare number, watching their Medicare summary notices, etc. Also want to bring in to your attention that this month we've got our third annual fraud prevention conferences that are coming up. They are on June 13th, June 20th, and June 27th this month at MetroTech. This is on their Spring Lake campus. You see the little QR code there that you can scan in the middle to get more information about those. We've got speakers that are going to be from the FBI, the Securities Commission, the Oklahoma County Sheriff's Department, lots of really good speakers at each one of those dates. So I would encourage you to scan that code, learn more about it. You can attend in person, or if you'd like, you can attend in the privacy of your own home, just watching it on your computer. We've also got some listening centers that are set up around the state. Several of the technology centers have volunteered to be listening sites where people can come and watch on a big screen and participate from those centers. So I would encourage you, get on there, learn about it, participate, become more aware of the various types of fraud that are targeting our seniors across the country, actually. But we definitely want to make sure that all Oklahomans are very aware of this. So please make yourself very, very aware and protect yourself. We also want you to do your part in making sure that other people are aware. Not everybody is watching this webinar. Not everybody is going to attend the fraud conferences. So each of us is responsible for making other people aware. When you're out playing cards, when you're attending church, when you're in any kind of a social setting, share information, talk to each other, make people aware of the things that they can do to protect themselves and each other from becoming a victim of fraud, not just within the Medicare system, but in other areas of their lives. So let's get started on talking about our topic today, which is Medicare fraud. First, little education. The grant that funds our division to talk about Medicare fraud is a grant called the Senior Medicare Patrol. It began back in 1997, and it started out as a demonstration project with about 12 states. And it worked so well that they expanded it. Now we're in all 50 states. We're in several of the territories. There's over 500 local sites nationwide. We've got over 5,000 team members. And a lot of those team members, folks, are volunteers. They're not paid staff people. They're just people in the community who want to help, who go around and they speak, they educate, they take down information. Some of them work as counselors and they help people by gathering information about specific fraud cases. Sometimes they work at booths sharing information and educating people. In other situations, they just go around distributing pamphlets and materials to libraries and places like that. So there's lots of ways that people can help out with this program. Our primary goal is to educate everybody about Medicare fraud, errors, and abuse. Our biggest effort is we want to prevent fraud. Yes, we want people to report fraud when they think it's occurred, but man, if we could prevent it, if we could keep people from becoming a victim of fraud, that would be so great, because it's a whole lot better if we can keep people from becoming a victim. If people could stop from being a victim in the first place, it's a whole lot better story. So who gets hurt by Medicare fraud? Well, obviously, the first thing that we think about are seniors. We think about people who are on Medicare, the beneficiaries themselves, because, it creates billing problems. You see something on your Medicare summary notice or your explanation of benefits that shouldn't be there, and then you got to go through all the hassle of getting that corrected. It creates personal financial losses because oftentimes the company that thinks that they are dealing with you is going to start sending you bills for the balance of what might be owed because someone used your Medicare number to seek services. And frequently what happens a lot of times with our seniors is they get so stressed out about receiving these bills that they just go ahead and pay that balance because they don't want to hassle with it. So there's a personal financial loss associated with it. It creates incorrect medical records. Sometimes if there's a charge that appears on your Medicare summary notice for some service that was provided that might have been related to, let's say, cancer treatment or diabetes or something like that, and you don't have cancer or you don't have diabetes, then there's a problem there, because now it looks like in your medical records that you do have those conditions, and that can impact your ability to get life insurance or something. Also, medical identity theft. Now, all of a sudden, somebody else is running around using your identity to get treatment and to seek services. The quality of your treatment can be impacted. Your health itself can be impacted because let's say that, God forbid, that you're in a car wreck or you're in some sort of accident where you're going to arrive at the hospital unconscious. The medical personnel there are going to be looking at your electronic health record to identify how they should treat you. If there's information in there that indicates that, as I said, maybe you've got cancer or you're a diabetic or there's some other health indication that says, oh, wow, we can't treat this person this way because of this health indication, that in fact, maybe you don't have that condition, it can impact how that hospital is going to treat you because you're not conscious to tell them, wait, that's not me. So it can have some very serious impact. But the other thing that we need to keep in mind, just as consumers in general, is Medicare fraud, errors, and abuse impacts all of us because it's taxpayer dollars that actually go into the Medicare Trust Fund. If you're working and if you're paying into the system, then it's impacting you as well, no matter what age you are. Because regardless of whether you're on Medicare yet or not, those taxpayer dollars are what's paying those claims that are being paid inappropriately. So it's very, very important that all of us are paying attention to this problem and doing everything that we can to fight Medicare fraud. The mission of the SMP program is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. That is a huge part of what our program is about. Yes, we're going to be here if you think you've been a victim of fraud, but wow, if we can get out there and educate everybody on the ways that they can protect themselves and find out about fraud in its earliest stages, that's our big goal there. So what exactly is fraud? You know, we talk about fraud, we talk about errors, and we talk about abuse. Let's talk about what each one of those looks like. Fraud itself is intentionally billing Medicare for services that were not received or billing for a service at a higher rate than is actually justified. And the key word here is intentionally. This is an individual or individuals who specifically set out to commit a crime. They knew what they were doing was wrong, and they're trying to commit a crime against the Medicare system. Now, what's abuse? Abuse is when a provider, somebody that's providing a service or a product that is not medically necessary or that doesn't really meet the professional standards for someone to receive that particular service. So it's not necessarily fraud, but maybe they're going a little bit further than they need to with the services that they're providing to an individual. And we've got some examples of that here in just a second. So here's some examples of fraud and abuse. The first one there, billing for services or supplies or equipment that were not provided. We're seeing a lot of this right now where we've got people who are contacting us and saying, hey, I've got some charges on my Medicare summary notice for services that I didn't even receive. I've never, received this particular medical test or something like that. Why am I seeing charges on here? Or I got a charge for a wheelchair and I've never used a wheelchair in my life. Billing for excessive medical supplies. This would be a situation where perhaps a person did receive a COVID-19 test, but they're seeing on their Medicare summary notice where they're seeing charges for like 4 or 5 tests. Obtaining or giving a Medicare number for free services. An example of this would be maybe you went to the mall and there was a booth there that said free flu shots. Or something of that nature. And all you had to do was give them your Medicare number. Well, the reason why they want your Medicare number is so that they can bill Medicare. So if that's the case, that's not really a free service. That's why they want that Medicare number. And the scary part is they probably want that Medicare number to bill for a whole lot more than just that shot. They're going to take that Medicare number and probably bill for several other things. So don't fall for that. If the sign says free, they don't need your Medicare number. Improper coding to obtain a higher payment. This is really challenging sometimes for us as a consumer to identify because, we're not trained coders. We don't know this sort of thing. So on this one, what you're really going to have to pay attention to is that Medicare summary notice. The way the Medicare summary notice is designed is they've got to put the service that was provided in a little bit more plain language so that you know what they billed for. So here's an example. You go to the doctor and the doctor provided some maybe we'll say that they did like a simple x-ray of your knee, and they put you in an x-ray machine and they took an x-ray, and then a few months later you get your Medicare summary notice and you see a charge on there, but it says it was for, let's say, an MRI, but you didn't get an MRI of your knee. That would be an example of where they might have accidentally coded for something that was for more than what you actually got. The next one, unneeded or excessive x-rays and lab tests. Now, this is a situation where, we're just regular folks. We don't really know enough to know what would be considered excessive x-rays or lab tests. It's not our job. You know, we rely on our physicians and other providers to know what's, if a test is necessary, uh, and where the line is. So don't feel like you've suddenly got to become a nurse or a doctor or a lab technician or something like that. Hopefully Medicare is going to be on the lookout for things like this. But sometimes as a consumer, you can kind of tell if you're taking a lot of tests that seem to be over the top, and you can report those things for Medicare to review if you feel like that might be excessive. But don't feel like it's got to be your job every time you go to the doctor to wonder whether or not you're taking a test that's too much. Claims for services that are not medically necessary. Again, you'll know whether or not you feel like, if you've gone to the doctor and it's maybe just for a physical or something like that, but there's a test that you feel like maybe the doctor is suggesting that you get done, but it's for you're not having any symptoms of a condition that maybe the doctor wants you to have some tests for, that might be an indicator. But again, don't feel like you've got to be a physician and be second guessing your doctor all the time. Using another person's Medicare number or letting someone else use your number. Now, folks, this can get a little bit tricky because in this situation, guess who the criminal could be? It can be us. You do not want to let somebody use your Medicare number. I know it sounds noble and it sounds like you're helping out somebody, but folks, you can't do that. If everybody lets somebody else use their Medicare number to get services and stuff, it's going to really mess up the Medicare system, and you can be held liable for those charges. Not only that, but it can also set up a situation where you cannot go to any provider that you want to. Medicare can say, okay, from now on, because you did this, you're going to have to go to this specific doctor and this specific hospital, et cetera, et cetera. So do not do that. And you can also go to jail in some situations. There have been situations where organized crime have paid Medicare beneficiaries for their Medicare numbers. And in those situations, the Medicare beneficiaries have been held as accomplices to those crimes. So please, please, please don't let anyone do that to you. Now, what about errors? We're all human. People can make mistakes. The Medicare system can be incredibly complicated. All of the services that you receive, any equipment that you use, everything has been drilled down to a code. There's a code for everything. And for each one of those codes, there can be modifiers that are also, guess what, a code. So it can get very, very complicated. And the people that do all this coding can make honest mistakes. And so a lot of times what we see that may not be correct isn't necessarily fraud. It's not necessarily abuse. It could be an honest mistake. The only way to tell what the difference is for a professional individual to get in there and do a review, to do an investigation and actually identify. And they have to really dig around sometimes to be able to tell whether or not this was an honest mistake or if somebody did this on purpose. What are they looking for? Well, sometimes they're looking for repetitive situations. Did this person make this mistake once, or is this something that we're seeing a pattern? They've done this a lot of times, in which case, hey, maybe this is abuse or maybe it's fraud. So That's why it's important for these things to get reported so that they can get stopped early on. If this is an honest mistake, I promise you, providers want you to report these things so that it doesn't become something that if it's an honest mistake, they don't want to get in trouble and it actually get they become accused of abuse when all they were doing was making an error over and over again. So uh, trust me, if you report something that's an error, your providers are actually going to be very, very grateful to you. So here's some examples of some of the fraud that we're currently seeing. We're getting a lot of calls still, if you can believe it, about the new Medicare card. As you know, if you've been on Medicare for any length of time now, the old Medicare cards or the old Medicare number used to contain your Social Security number, and that was a big area of fraud, not just in the Medicare system, but everywhere. And so they switched it, and they now have a new non intelligent number that's not tied to anything. But we've got all these new fraud schemes that have come out where they're calling and they're saying that as part of the new Medicare cards, they're going to come out with a new plastic card. And this new plastic card is going to be a lot more durable than those flimsy paper cards. So if we could just get your Medicare number, we'll make sure that we've got the right person and we'll send you out this new plastic card and that's going to be great. So don't fall for it. Medicare is not going to send you a new plastic card. Also, Medicare is not going to call you on the telephone. The people at Medicare, as well as Social Security, they're going to communicate with you through the mail. So if you get a call from someone claiming to be from Medicare or from Social Security, chances are that's a fraudulent phone call. And in the very, very, very rare occasions that somebody from Medicare or Social Security were to call you, they will never ask you for your Medicare number or your Social Security number. Trust me, folks, they've already got it. So don't ever give that information out. Just hang up the phone. Also, you're going to get a call from someone saying, ooh, we've gotten a claim and it's got your Medicare number on it. And we're very concerned that someone is trying to use your Medicare number. And, this claim is for, $20,000. And so could you please verify your Medicare number? Don't do it. Don't give them your Medicare number over the telephone or a call regarding your Medicare coverage and that there's concerns that your Medicare coverage has been compromised. People, if they start asking you questions about your name, your date of birth, address, any personally identifiable information, that's nobody's business. Don't give that information out. We're often getting calls from people who have your name and they may even have your date of birth. Unfortunately, people, there is some personal information that has become available on the internet through the dark web. Don't assume that just because someone has one or two pieces of your personal information that they've got everything or that they're who they claim they are. Hang up the phone. Don't engage in a conversation with them. Don't try and be smarter than them. Don't try and catch them in a lie. Don't play the game. Just hang up the phone. Now, here's a big area where we're catching a lot of the fraud right now. Even if you do everything you're supposed to do, even if you guard your card, even if you hang up the phone, unfortunately, there are some situations where people have been able to get someone's Medicare information and they've been able to get their date of birth. And we're seeing on their Medicare summary notices where there are charges that are showing up for medical services that person did not receive. In some situations, that could be genetic testing, maybe for a cancer screening or for a genetic precursor for cancer or something like that. And this person never received that test. In other situations, it can be for continuous glucose monitoring, as if the person had diabetes, and this person may not be a diabetic. A big one that we're seeing a lot of is for urinary catheters. And this one kind of popped up out of nowhere. People were calling us about things like COVID-19 tests back during the pandemic and other charges. And And some of our counselors actually pointed out, no, I am seeing a few charges here for your urinary catheters. And the person was very shocked and surprised to hear that there were any charges for urinary catheters because they didn't use them. And so you've got to pay attention to the Medicare summary notices. That's the document that comes out every 3 months from Medicare that shows all the charges that Medicare has received on your behalf. Also, explanation of benefits. If you're on a Medicare Advantage plan, you're going to actually get an explanation of benefits from that plan, and you need to take the time to review that very carefully and make sure that it's accurate. Did you go to the doctor on that date? Did you receive those services? Did you receive that many tests? Did you go that often? All of that stuff. Make sure that it's accurate. So let's look at this. Why did they pick out urinary catheters? Is there a reason why they would pick something like that? Okay, for one thing, it's a relatively low cost item. So they're hoping that it's going to kind of go in under the radar screen for Medicare. Medicare is going to say, it didn't cost very much. So why would we pay attention to that? Let's focus on the high ticket items. Another reason why they think about that is because it's a used once item. Once it's used, it's disposed of. So people are going to have to buy several of them. So even though it's relatively low cost, you got to use a lot of them. You're required to use them multiple times daily. So again, relatively low cost, but you got to use several of them. And it's something that several seniors do use. So again, it's not necessarily something that's going to catch the attention of somebody at Medicare. So this is one of those things that probably someone at CMS wasn't going to catch. It's not going to catch their attention. Well, it has now, trust me. So those are kind of the things that are things that we're seeing right now in terms of the fraud problem. So what are the things that people need to do? There are 3 things that we emphasize in the Senior Medicare Patrol program. Protect, detect, and report. If you remember nothing else, remember these 3 steps. Under protect, there are 3 things that we want you to do there. 1, treat your Medicare card just like it's a credit card, because trust me, in the hands of the right person, that's what it is. Your Medicare card is deep, deep pockets, folks. Your credit card, what makes a credit card so great is it depends on your credit line. Think about how much the credit line is on your Medicare card, folks. That's a lot of money there. So if they can get a hold of your Medicare card, they're going to charge up as much money as they possibly can as quickly as they can. You want to watch out for identity theft. So if someone's gotten your Medicare card and you start seeing charges for services that you didn't receive, that's a clear indication that someone has gotten your Medicare number. It could also indicate that they've gotten more than just your Medicare number. So look for other places where you might see other charges. Because the possibility is, what if they got your Social Security number as well? So look for anything else, like on your bank statement, look on your credit card statement as well. Look for anything else that might look fishy. Be aware that Medicare doesn't call or visit or sell you anything. So don't, if someone shows up at your door claiming to be from Medicare, shut the door. If somebody calls you, hang up the phone. The free medical services, we already talked about that. If they say it's free, it's free. They don't need your Medicare number. They don't need to see your driver's license. They don't need any of that stuff. Don't give out that Medicare number to anyone except for your doctor or to another Medicare provider. Don't give it to anybody over the telephone unless you absolutely 100% know who you are talking to. If somebody calls you on the telephone claiming to be a Medicare provider, it is perfectly okay for you to say, you know what, I'm not sure who you are. So what I'd prefer to do is I'm going to hang up and I'm going to look up the phone number for your office and I'll call you back. If they're genuinely who they say they are, they're not going to mind in the least. In the past, we've had situations where people just, everybody loves Facebook. People will get on Facebook and they'll say, pray for me, I'm going to have surgery next week. And, people may or may not know what hospital you're going to or something like that. Well, the bad guys are paying attention to Facebook too. And if they get on Facebook and they see that you're going to have surgery, they may know that you're probably going to go to one of the local hospitals, and they're going to call claiming to be from that hospital, and they're going to do a little pre-admission paperwork with you. Don't fall for it, folks. If you don't know for sure 100% who that person is, you make the outbound phone call. Protect yourself. Don't carry your Medicare card with you unless you know you're going to need it. If you know you're going to the doctor, fine. If you know you're going to the hospital, fine. But otherwise, just leave it at home. If you're in an accident or something like that and the ambulance has to take you somewhere, they're going to treat you. Don't worry about that. You can give them the Medicare information later. Step 2, detecting fraud. This is where that Medicare summary notice comes in handy. You want to make sure you're looking at that statement every time it comes in. Look for services you didn't receive. Look for double billing. Look for any services from a doctor that you didn't see. Anything that looks suspicious. And folks, we've seen some really weird things. We've seen services from people that from other states and stuff. So take a look at it. You can also sign up for an account on www.medicare.gov. So you can go to www.medicare.gov. You can sign up for a MyMedicare.gov account. You'll be able to see charges in real time rather than having to wait for 3 months for your Medicare summary notice. It allows you to see things much more quickly and report them much more quickly. So if you haven't signed up for that account, I encourage you to do so. It's very secure, and it's a way for you to see things much faster. And it also gives you the ability to take advantage of some other services. So look into it. Also, if you do not have one of these, we have free healthcare journals. We give these out to folks because this gives you the ability to keep track of your doctor's visits, keep track of your medications, your allergies, all of that good stuff right here in this handy little booklet that you can carry around with you. And then when your Medicare summary notice comes in, you can use this to help you keep track of those visits. It's kind of like keeping a track on the balance in your checkbook. For those of you who used to have to keep track of that, like we used to, nobody knows how to balance their checkbook anymore because we all use credit cards and debit cards now. But for those of us who've been around for a while, you'll know what I'm talking about. Then lastly, report suspected fraud. Now, as I said before, if you see a charge that looks suspicious for a provider that you've actually seen, call the provider first. If it's a mistake, they are happy to fix that. But if after talking to that provider, you still think something seems strange, give us a call at the Medicare Assistance Program. We would be happy to talk to you about it. Our services are free and confidential. If it turns out that it's something that we can help you understand, great, no problem. But if it turns out that it's fraudulent, we will also help you report that. Now, I mentioned volunteers before. If you're someone that's interested in serving in your community, maybe you just want to be a resource for a smaller area, like maybe just in your church or something like that, that's great. We would love to have you. Maybe it's just helping us distribute materials or standing at a booth, giving presentations, just in whatever capacity. If that sounds like something you would be interested in, you can give us a call at the same phone number or shoot us an email. We would be very interested in talking to you, and we can tell you more about how our volunteers help. So here's information. That's our website there, map.oid.ok.gov. There's our toll-free number, 800-763-2828. You can use that number to report suspected fraud and abuse, to ask for a speaker, or to request materials. If you want to volunteer, you can also give us an email at map@oid.ok.gov. We would be happy to talk to you. So also wanted to let you know, we have partner agencies around the state. Here is the names of the agencies and their phone numbers, as well as the counties that those agencies serve. So if you'd like to talk to somebody local, they also come out and speak. So if you'd like for someone to come and talk to your group, your church group, civic group, congregate meal site, whatever the case may be, they are happy to come out and do that. So I know that we are a little bit long today, but folks, this is a very important topic, and I'm glad you could join us today to learn about this. Wyatt, do we have any questions?
See, someone said EODD AAA is a host site for June 20th. Good
Yes.
to know. And then somebody else said, I have a problem. My PDP company called me to see if I wanted to use their mail-in service. They asked me for my year of birth for identification. I refused to give it to them.
Wyatt, I'm old. Could you say that about half speed?
Somebody said, I have a problem. My PDP company called me to see if I wanted to use their mail-in service. They asked me for my year of birth for identification. I refused to give it to them.
Well, that's interesting. So they're talking about their prescription drug company that they've got their Part D prescription drug plan with, has a mail order service and was offering it to this person, and they wanted their date of birth. So that would be another situation. If this is a service that you're interested in, it would be perfectly okay to hang up and call your Part D drug plan. Their customer service number is on the back of your ID card, and talk to them about doing the mail order service. So that could actually be a great catch there in case that was somebody just trying to get your date of birth. So that could be a good catch. Anybody else? Okay. So Wyatt, if there's not any other questions, I know that we're over time. Guys, I really appreciate you joining us again today. Do not forget, it's Medicare Fraud Prevention Week. Please go out and talk to somebody. Have them reach out to us. We've got to get a handle on Medicare fraud. $60 billion is lost every year to Medicare fraud, errors, and abuse. That's $60 billion that is not going to pay for needed healthcare services. And the only way we're going to get ahead of this, it does not matter how much I go out and talk about this topic, unless you as Medicare beneficiaries report any of the fraud that you're seeing, we're never going to get ahead of this. So please, please, please play an active role. Get involved and take a stand. Help us fix this problem. So, all right, I will stop talking about this and get off my soapbox. Have a great week, everybody, and look forward to seeing you next month. Thanks.